Well, good afternoon, everybody. Thank you for coming today. My name's Mike Klag. I'm Dean of the school. And I thought I'd start out, well, it's been a tumultuous few days, to say the least. And I sent a note out yesterday to the school community, and I thought I would just reference that a little bit. I've lived in Baltimore for 30 years. And I didn't realize how much Baltimore has become a part of me, and I've become a part of Baltimore until the last few days. It was really tough on Saturday. But I decided to write a message, and there were several students here who helped, and faculty, and I just want to read a little bit of what it says, because I really, really believe it. The anger, violence, and grief flowing through our communities were sparked by the tragic death of Freddie Gray, but their roots run much deeper. As part of the East Baltimore community, our school must find ways to help our neighborhoods heal. Public health has the tools and the focus to understand the underlying causes of violence, including racism, economic disadvantage, social inequity, and policing strategies, and to develop transformative solutions. And that's why we're here today. This is the first step. We've formed a committee of faculty, staff, and students. It's being led and coordinated by Josh Sharfstein, who's our Associate Dean for Practice and Training. And this was the first recommendation, to come together now to talk about how we move ahead. And so we have some great speakers who are going to start that. I want you to know that the committee is open to everyone. And if you would like to participate, give input, please contact Josh, and feel free to contact me. So I'd like to start, before asking Josh to come up, with just a moment of silence to remember the death of Freddie Gray and the aftermath that's affected our community. Thank you. So probably Josh doesn't need an introduction. I'll just tell you a little bit about Josh. His family has deep roots in Baltimore. His grandparents lived in Baltimore. He visited frequently and has lived here for many years, and knows the city as well as anyone because he served as the Commissioner of Health for Baltimore, and then went to the FDA, and then came back as the State Health Commissioner. And in many ways, he's the perfect person to coordinate and lead us as we embark on this journey. So, Josh.
Thanks. I don't think that's my theme song. Thank you. I want to thank Dean Klag for bringing us together and for his message, which really, right from the start, I think viewed what has been happening in the right context, a larger context, public health context. I appreciate the chance to be involved. And the purpose of this particular event, this is the very first internal kind of engagement that is starting, but the purpose of it is to really talk about the immediate actions that the school is going to be involved in. And the line from Dean Klag's email that stuck with me is that we will be engaged and we will stay engaged. And the purpose is to really set up a sustained engagement and contribution for the school to the communities and to the city. And I think you're going to be aware today of the different opportunities, the different things that are already moving, and the different opportunities to contribute to those things, as well as be involved in other opportunities. I'm going to be a little bit of the MC, but I will be making sure that as we get into the different activities that people know what they themselves can do. Let me also thank the people who came in yesterday despite the closure of the school to immediately get involved. There was a group of graduate students that wrote the dean right on Monday, I think, and led to a number of discussions yesterday, which were the basis for today. I see a number of them: David, Lauren, Kelly, Renee, others. I want to thank them. And as you'll see, they've gotten involved in ways that other people and you all could get involved as we get going. And let me also say that this is going to be an engagement that involves a lot of work with community organizations and communities around the campus. And as you'll see, the building blocks for sustained work in those areas, many of them are there, and that will unfold over the next few days as well. So in terms of our plan, I'm going to first ask Professor Debra Furr-Holden to provide some background on what is going on, how to think about it. Dr. Furr-Holden is a perfect person to do this, in part because she was about to be the moderator of an important symposium at Johns Hopkins before it got canceled yesterday with everything else. So she's been thinking about this quite a bit. She's also, I think, in a class by herself in terms of the type of work she does at the juncture of public health science and social justice work in addiction and poverty as well as health. And I've also had the opportunity to work with her in my various roles and know about the kind of intellect and ideas that she brings to any topic she's involved with. So I really appreciate that she was willing to do this. After she speaks, we're going to go through a couple of the initiatives that have been set in motion, and people who are involved in those initiatives are going to be explaining them and I'm going to be making sure they're explaining how people can get involved in each of them. After that, I have asked for the representatives of the faculty and staff assistant program and the student assistance program to come here and just briefly make sure that everybody is aware of what resources are here for you in case of a particular stress and other issues that you may be experiencing. And then after that, we should have quite a lot of time for some discussion and reflection, which I will be kind of moderating, and we'll bring up the various people who have talked to that point as well to respond and reflect. You'll hear about some of the things that are happening. This is the very beginning. There's going to be a major event planned for next week that you'll hear about as well. So I appreciate everybody coming, and I think that what we want out of a sense of frustration and powerlessness as you're seeing these things happen, to feel like we are at a place and at a school that is really going to be putting everything it has to improving Baltimore. So I'm looking forward to today, and with that, my pleasure to introduce Dr. Furr-Holden.
So I was one of the folks that came in yesterday at the behest of a lot of our students, and I'm really grateful for the opportunity to be on faculty and serve with some of you. This situation that's happened, I think, hits very close to home in that we've seen instances like this across the country, but now it's in our own backyard. And so I want you to kind of listen to everything that I'm going to say through a particular filter, be listening for what can you and your chair do if you wanted to be somebody who was willing to move the needle on some of these issues, as well as what can we as an institution, a body of scientists, practitioners, policymakers, et cetera. So I wanted to just recap what it is that we already know and what have we been told about what happened with the Freddie Gray incident that happened here in Baltimore. So in short, the incident was precipitated by several police officers on bicycles who encountered Freddie Gray and another one of his friends in their own neighborhood. And what initiated and precipitated the incident was that he made contact with one of the police officers. For reasons yet to be determined, after making eye contact with no provocation, no additional interaction, Freddie Gray took off running. At some point during the incident, he was engaged with officers, and he was a known asthmatic, and he was requesting that he get his inhaler, but he didn't get it. So we know that he had some breathing problems. And then he was ultimately placed into a police van, and that van made at least 2 stops before reaching the police station ultimately. And there's no footage to actually show what happened on those 2 stops, but we know that 2 stops were made. They were logged in with the police department. And then ultimately, Within about an hour and a half of his initial interaction with police, he was seen by medical professionals, and it was determined that he had sustained severe injuries to his spinal cord as well as his larynx that happened during the course of being detained in police custody. He died a week later of those injuries. Okay, those are the facts and the what so of it. So some of the latest reports from public officials, you can see from this article in the Baltimore Sun that Baltimore City Police do acknowledge some mistakes were made in his death, and two quotes, one from the police commissioner, Anthony Batts. "We know our police employees failed to get him medical attention in a timely manner multiple times." And then a quote from our mayor, Stephanie Rawlings Blakes, "I still want to know why none of the officers called for immediate medical assistance despite Mr. Gray's apparent pleas. I know this is unacceptable and I want answers." Okay, so Freddie Gray did not happen in a vacuum. Just to give a little bit of background and context, he's not the only one in Baltimore. There have been several incidences of deaths and severe injuries while people were under the custody of the Baltimore City Police Department. One of the more prominent examples is a young man by the name of Tyrone West. This happened July 18, 2013. There were 8 police officers involved in total. It was a routine traffic stop. Mr. West was stopped by 2 traffic officers. He was pulled over, asked to exit his vehicle. When he refused, he was maced. The officers maced themselves, called for backup. An additional 7 officers arrived on the scene. 8 of them had a physical interaction with Mr. West, and he subsequently died that same day as a result of that interaction. The same 2 initial police officers that pulled him over 18 days earlier had beat an African-American man in a routine traffic stop, and the quote from this young man by the name of Abdul Salam, who's been very instrumental in what's been happening around Freddie Gray, said, "I was basically beaten within inches of my life over a seatbelt violation." He was actually pulled over as he pulled into the driveway of his house in a minivan with his 3-year-old son in the van. He ultimately settled that case in civil litigation with the city, and the maximum penalty for civil litigation against the police department in Baltimore City is a penalty of $200,000, and he was awarded the maximum. In the case of Tyrone West, that case is still pending. No officers have been charged or prosecuted in that case, and his family is currently suing the city, although the medical bills for Mr. West actually exceed the amount that they would receive in civil litigation. So he's not the only one. There are others. I will skip past those, but there are plenty of others who have died within police custody in Baltimore City. Some of the events of those situations are known and some are not known. Just to put it in a context, statewide, 70% of police in custody deaths are African American, and 40% of that total are unarmed. Between 2010 and 2014, 109 people died while in police custody. A third of those cases happened in Baltimore City. We represent the highest rate and proportion of deaths based on population and the total number of deaths. And again, a total of 31 of those deaths occurred in Baltimore. Baltimore City, with a maximum liability payment of $200,000 per case, has paid more than $5.7 million in judgments across 102 cases alleging police misconduct between 2007 and 2011. On a national scale, we know there are several other incidences very similar to Freddie Gray, including the case of Eric Garner, again an unarmed African-American man in New York City. He was placed in a chokehold by police officers for 15 seconds, and he subsequently died as a result of his interaction with the police. There are 0 prosecutions in that case. There's also Michael Brown, who was fatally shot in Ferguson, Missouri, by a 28-year-old white officer. There are 0 prosecutions in that case. And then there's the more recent case of Walter Scott, who was an unarmed 50-year-old male. He died in North Charleston, South Carolina. I'm sure many of you saw the video of him running away from a police officer, and he was actually shot in the back while running away from that officer. That officer has been charged with homicide. All right, so here's what the media has portrayed so far on what happened with Freddie Gray in Baltimore. So this is an image of a memorial that was created for him in his community of Sandtown, Winchester. And you can see there are liquor bottles and champagne bottles in front of a piece of graffiti art in the community. The media has also portrayed much of the violence that's happened and the outcry from this case. And here's a snapshot from the Wall Street Journal, because this actually garnered the attention of the national media. And it says, "Violence breaks out in Baltimore after Freddie Gray's funeral." Many of you are aware that the mayor made a comment about much of the protest that was happening, and she literally was quoted as saying, "The city is being destroyed by thugs in a senseless way." So our citizens have been labeled thugs in the face of this. And what the media also portrayed, and many of you saw this last night, I watched CNN with my family, and I was quite alarmed. I was one of the folks that was requested to leave the campus at 2 o'clock yesterday, and I came out to be greeted by a cadre of very handsome but full armored National Guardsmen. They were really cute. I was glad I had my heels on. But this is what the media is portraying about what's happening here. So Baltimore enlists the help of the National Guard and a curfew to fight a few riots and looting. Okay, so this is what the media has not portrayed. How many of you have heard of the Black Westchester magazine? A very, very small number. This was the only positive article that I could find about what was actually happening in Baltimore. So before last night, there were about 24 arrests, and last night about a dozen and a half arrests were made. The lion's share of protesters and what was happening around the Freddie Gray incident were nonviolent protests. So this is what the media didn't tell us about, and it's just one specialty magazine that, particularly if you see their subtitle, The News with a Black Point of View. This journal literally was highlighting the positive aspects of what were happening, and it was the only media find that I could find that demonstrated that the lion's share of the people involved in protests were actually doing so peacefully. So I think one of the big questions we want to ask ourselves, besides what can we do, is why did Baltimore burn after Freddie Gray? We've had other cases. I could cite 7 or 10 that are equally egregious. And like I said earlier, many of you have never heard of Tyrone West. He died 2 years ago in July. His mother, they call it West Wednesdays. If you go to City Hall on Wednesdays, his mother and a group of her church friends and his sister protest in silence every Wednesday. And you've never heard of them because that doesn't make the media. So the question is, what was it about Freddie Gray? How did that catch our attention? How did that land us as the hot spot on CNN and the benefit of these very buxom National Guardsmen trolling our campus? Why did Baltimore burn after Freddie Gray? So here's what I would like to ask you folks. Was it education? If you look at this map, this is the predicted graduation rate from a regression model, which I'm sure you all are familiar with. These are predicted probabilities, versus the actual graduation rate. And you can see that Baltimore's actual graduation rate of just under 60% was a little bit better than their expected graduation rate of just over 50%. But still entirely and completely wholly unacceptable when you look at the other jurisdictions within the state of Maryland. So the question is, was it education and the educational gaps and disparities? Is it vacant housing? Baltimore's been steadily decreasing in population size since the 70s. We've lost about 300,000 of our population, leaving many of our most underserved and impoverished communities clearly at the effect of urban blight, and mostly those communities are poor African-American communities, like the ones where Freddie Gray came from. A lot of our work focuses on the lack of access to healthy food, so it asks the question, is it food deserts? Nearly 60% of our youth live within a quarter-mile or walking distance of an alcohol outlet, but only 13% of them live within walking distance to a healthy food outlet. So when thinking about what was it that had people being such upset, was it the food deserts? Is it poverty? Nearly half of Baltimore City's children live in poverty, including Sandtown, Winchester, where Freddie Gray came from. And my area of research is, was it his neighborhood? He lived in a community that has one of the highest rates of violence in the city and one of the highest rates of poverty. So all of these sort of begin to create a picture and tap into much of what I know is our research and our expertise. But the real question is, why did Baltimore really burn on Monday? What caused such the outrage and the upset? I call it a tale of two cities. I did an article for Rolling Stone magazine a few years ago. It's like, you know you've made it when you get to do a Rolling Stone article. And I got to do it with David Simon. One of the actors on the show who played Snoop, Felicia, who played Snoop on The Wire, shortly after The Wire ended, became re-engaged in the drug trade. And she was actually caught and faced criminal charges for possession of a very large quantity of drugs. And it begged the question, how could someone who was a star on a hit show like The Wire return back to that life? She had now the resources and the means and all of the things that one would think would lead to success that would dissuade her from being involved in that environment. But the reality is the city of Baltimore that she grew up in is very different than the city of Baltimore that many other people grow up in. So you can't really blame the looters. You can't really blame the folks that were rioting. We really can't even blame Freddie Gray's death. The real culprit in this problem is actually not a new problem. So I want to just give you some real factual information so you can understand what it looks like to live in one city that's actually two cities. About a quarter of Baltimore residents live below the poverty line. The unemployment rate in zip code 21217, which is where the riots broke out on Monday, is 19%. Less than 60% of Baltimore high school students actually graduate, and we have the worst graduation rate in the state by far. Taken together, these disparities illustrate what poverty is like in big city America, and the effects are brutally obvious in Baltimore's healthcare statistics. Black infants in Baltimore are almost 9 times more likely to die before age 1 than white infants. AIDS cases are nearly 5 times more common in the African American community in Baltimore City than they are in any other community. And only 6 miles separate Baltimore's neighborhood of Roland Park and Holland's Market, but there's a 20-year difference in the average life expectancy. These inequalities, to me, are staggering. Baltimore's infant mortality rates mirror those of Moldova and Belize. A leading superpower, we have the same infant mortality rate as Moldova and Belize. So while more focus on the social determinants of health is needed, these are not new problems. We also need more culturally competent policing. We need to address the social determinants, better housing, better education. And my plea to each of you is to not talk about the social determinants of health in a very broad and global way, but to be very specific. The statistics are staggering, and we as public health practitioners and researchers know the statistics, and it's our job to use those metrics and measure our success by how much our work moves the needle on those metrics. We have to stick with those metrics. That's what we do. So when you think about why Baltimore City burned, all of these factors play a role. But the people who live in the other Baltimore City where Freddie Gray comes from, that day they had just had enough. And the glaring, staggering disparities that face this city, that make it a city that's one way for one person and another way for another person, based solely on where you live and what color of your skin, bubbled over that day. And that's why Baltimore City burned on Monday. What's the real human side of this? There's a very real human impact. There's a fear, and one could argue whether or not that fear is valid and whether or not it's rational. But when you look at Freddie Gray, all he did was make eye contact. So as a mother of an African-American young male, 15, what do I say to him? Just don't make eye contact. Then you have another man who was running away from a police officer and was shot in the back. So, well, make eye contact and answer their questions, but don't run away. But then if you run away, you get shot in the back. This is a very tumultuous time for our city and for our nation. There's a fear and upset and an unease with what's happening in the system, and one could argue that it's very valid and rational given all the circumstances that have happened. One of the other real impacts of the human experience is people being robbed of the basic experience of just being human. Again, as a mother of an African-American male, I would have loved to just tell him, just go be great in the world and rock those big curls that you inherited from me and your dad and just be cute, but I can't do that. Before he got to be a human being, he had to be a young African-American male. And I have to have very tough conversations with him every day. And I've had to help unpack this experience for him in a way that honors his humanity and doesn't rob him of the basic joy and right of just being a 15-year-old kid on the planet. There are catastrophic behavioral health problems that come out of incidences like these. I'm in the Department of Mental Health. My work is very much focused on the negative impacts on one's socio-emotional well-being, their mental health, and their psychosocial well-being. And they're very real impacts for people, the community, you. I receive calls from some of my students who live in East Baltimore who've never experienced anything like what just happened in Baltimore over the last 3 days. So the very real behavioral health problems that come out of this are real, both for the people who are actively engaged and living under those suppressed conditions, as well as the people like you who are the next generation of change makers who are taking the risk and coming into cities like Baltimore to study at places like Johns Hopkins so you can actually make a difference. A lot of stereotypes got reinforced. Again, the 10,000 protesters that did so peacefully and nonviolently got no media attention. Instead, the 3 dozen bad actors gave a reputation to Baltimore that only reinforced what everybody got from watching The Wire. I think overall this was a tragedy for the entire community in many ways, as well as for people across the nation. I know when we've had incidences that have happened in other cities, I've been personally impacted. I've asked myself as a citizen, as a mother, as a public health professional and researcher, as an intellectual and an academic, what role can I play in these problems? So I want to give you something, and then I want to pose a question that I hope we'll be able to talk about in this town hall. So the first question is, what can you, the individual, the person sitting in your chair, do? And the thing that I would encourage you to do is start with your fears of influence, with your family, your friends, peers. I know I've made a profound difference at my church. I worship at one of the larger churches in Baltimore City, and I've actually been able to make a difference and have my pastor speak about some of these issues from the pulpit. So I encourage each of you sitting in your chair, within your field, within your realm of political influence, there is something that you can do as an individual. And if you don't see an opportunity, start at your kitchen table. But the most important question, I think, and why we're here at this town hall, is to ask the question, what can Hopkins do? And I think that's the best question of all. Let's talk about it. But I want to give you a couple of caveats, because you could easily be seduced to run down to the front lines of North Avenue and Pennsylvania Avenue and stand with the National Guard to try to bring some peace to what was an outcry of the city. So here are some of the caveats. What's our mission? What is the mission of Johns Hopkins? Who are we as an institution, as a school of public health, and what is it that we declared ourselves to be and the difference that we were going to make on the planet by way of public health? And what are our values? What is our expertise? If you are not trained in riot tactics, and if you don't have combat gear, if you've never been trained in crisis situations, you shouldn't go down to North Avenue and Pennsylvania Avenue during the middle of the riot. That's outside of what we do, and that's outside of your expertise. And then the other question, and the thing I'd like you to think about, is what's really needed. There's a lot that's really needed in the community. But again, what are our mission, our values, what is our expertise? And the most important question is, where do these things come together? Where is the intersection of our mission, our values, our assets, our resources, the wants and needs of the community, and where do they all come together in a way that we could actually be impactful as an institution to address what's going on? Thank you.
Thank you very much, Dr. Furr-Holden. That was terrific and tremendous start to the discussion. I want to, next we're going to hear from 3 of the teams that have already started working. And let me just briefly explain that when we talk about what Hopkins can do, that is what Dean Klag can do, it's what I can do, it's what you can do, what the students together can do, the faculty can do. So as different ideas come up and different projects happen, and I know there are other meetings going on, the only thing I ask is if it's possible to let me know so that we can make sure that we can provide support to different things that are going on as best as possible. So first I want to ask Kelly King to come up. Kelly is a graduate student in Health, Behavior, and Society and was in yesterday. When you come up here, yeah, and then you'll take a seat over there, and maybe just give a quick summary of the project you're working on, and particularly how people can contribute if they're so inclined.
Hi, thank you all for being here today. So the project that I'm working on is a regular correspondence that can go out to the community to keep people informed about what's going on and can hopefully be one source to go for a lot of different information. So the information that we're including in the email to date is kind of an update on what the university is doing in its response, opportunities for service. So we've drawn on Source as a resource, as well as compiled information on volunteer opportunities across different organizations across the city so that students can get involved. And we're also including relevant news content, whether that's articles, video, that has to do with this issue, the public health nature of this issue, the social justice nature of this issue. In terms of getting involved, I would love help from anybody who has that interest. If you have content that you think would be good to go into this mailing and you would like to include that, email it to publichealthpractice@jhu.edu, or you can reach out to myself directly, kking40@jhu.edu, if you're interested in getting involved. Thank you.
I don't know about the other 39 K-Kings, but we really appreciate your help. I wanted to next ask Professor Levis to come up and talk about the project that he is leading. I will just say that I knew of Dr. Levis through his reputation for quite a while before I had the pleasure of meeting him and getting to collaborate with him. He is one of the national leaders in the area of health disparities and addressing health disparities, and it is, I also appreciate that he was devoting a good chunk of his day yesterday to thinking about a very interesting and important response that the school could lead.
So the project, I just want to say I'm just overjoyed by the turnout we have here today. I just wanted to say that, you know, having been here 25 years and participated in so many events over the years, not only at Hopkins, but also in the city of Baltimore, in both cities of Baltimore. You know, it's really, just feels good to see that this part of the city of Baltimore is this engaged and interested in what's happening throughout the entire city. So the project that I'm leading, you know, comes from a quote from Dr. Martin Luther King, who said that riot is the language of the unheard. And the idea is to use our resources to help the unheard to be heard. So we're going to put together first a web-based publication where people can reflect on what's been happening. And when I say what's been happening, I mean that the riot that occurred or the uprising that occurred or whatever language we decide to use for it is really just one event in a long series of events that has been occurring in this country, I would say going back to the nation's founding. That, you know, I'm not sure that deaths like Freddie Gray are any more common now than they were 100 years ago. I think what we have now is that everyone is walking around with a high-definition camera in their pocket, and that perhaps that's why we're getting more video and more knowledge about it. But I think that's a good thing. And so in the spirit of creating a voice for the unheard, an opportunity for the unheard, we're going to have a web-based publication where we'll be, as a community, as a Johns Hopkins community, writing of our reflections on what's happening, what it all means for public health, you know, kind of your response to what you think you can do, or we as a field of public health can do to address these types of problems around nationally as well as in Baltimore. But also, we'll be reaching out to community partners throughout the city of Baltimore to have them to contribute to this publication as well. Last night I had a conversation with the editor of Johns Hopkins University Press, and they may be interested in working on putting together a volume of reflections on what's been happening in Baltimore and what it all means for public health. And also in September, I'll be hosting a conference. This is actually already in the works, but maybe we can find ways to bring the Hopkins community more involved in it. A conference on African-American males and the police. And I see this as all being part and parcel of the same project. So I would love to have a cast of thousands involved. So as many of you that want to be involved, I will figure out a way to get you involved if you want to be. I don't, if you're interested, you can just send me an email expressing your interest, and we'll try to set up a meeting to kind of talk about how to get organized. My email address is very easy, tal@jhu.edu, tal@jhu.edu. Thanks.
Thank you very much. Thank you very much. So the next topic to bring up is that next Friday, May 8th, the school is going to establish a day-long engagement and teaching and learning session on the events and their origins and what the school can do over the medium and long term to make a difference for the city. And the planning for that event is being led by two of the chairs, Robert Blum and David Holtgrave. I'm going to ask Dr. Blum to maybe come up here, Bob, and give a little bit more detail and to let people know particularly how they can be involved in the planning and execution of next Friday. Thank you.
Thanks, Josh. Good afternoon. Thank you. I think it's important to put where we're headed in a context of where we've been. Because I think that it is too simple to say, well, where has Hopkins been all along, and why now did you wake up? And the reality is that's not the reality. The reality is that this auditorium and this school is filled with people who work endlessly on and with Baltimore. The Urban Health Institute has convened forums. Last week there was one on trauma where there were over 700 people in attendance. SOURCE brings together students from across East Baltimore with community agencies and organizations day in and day out throughout the year. We developed a compendium on violence and police relationship work that has been going on both in this school and across the university. And it is extraordinary. So we come to this conversation with a history of engagement, not that we just woke up to the issues. But there is no one who has lived for the last few days who doesn't realize we have an extraordinary distance to go. The conversation that we are starting today, we will continue in a significant way next week. Next Friday will be a day of reflection and learning. Our goals are to build skills in community Hopkins dialogue. Our goal is to see where, from a position of privilege, that this education gives us, what are our obligations, not in the next week or next month, but forever. And how do we move that forward? And it will be the beginning of a conversation. This morning, I sent an email to every department chairman asking her or him to please identify at least one faculty member and one student who will work with us to plan. Now remember, we're planning an event for next Friday, so we do not have the luxury of time. We will be having a meeting tomorrow at 12 to 1:30, actually 1:20, because a class comes into the room at 1:30. If you are interested, email me. For the department chairs, please have representatives from all departments involved. We'll be collecting ideas, framing this, and moving it forward. We will then be putting into place a program. We cannot require classes to be canceled, but we can encourage faculty to the extent possible, please suspend class next Friday. We cannot require staff to be here, but we will ask people in administrative leadership positions, please allow release so staff can be part of these conversations. We see this as an all-school event. And from this, we will then move forward in a thoughtful, clear, and deliberate way. I look forward to the conversations next week and to your thoughts and input.
Thank you very much, Dr. Blum. Dr. Holgrave, if you want to come on up too to be prepared. I would like to also at this moment ask Mindy Levin, who runs SOURCE, to talk about hands-on opportunities for people to be involved in the cleanup and other local community activities. For those of you who don't know, SOURCE is a very powerful collaboration between public health, medicine, and nursing. Recently celebrated its 10-year anniversary, and hundreds of students have participated and thousands of hours of work around Baltimore. It's really considered quite a model for other schools engaging with communities, and Mindy has been its leader, and I appreciate your coming. Mindy, thank you.
Thanks, Josh. So as Josh mentioned already, SOURCE is the Community Service and Service Learning Center for all 3 schools here, of health professional schools, medicine, nursing, and public health. And we have formed partnerships with over 100 nonprofits that are all here in Baltimore City. So what we do every day is focused on connecting our students, faculty, and staff with the Baltimore community. We've already had a lot of students, faculty, and staff have asked SOURCE, how can I be involved? And we're already speaking with our community partners to figure out what are the needs and how can we respond. And we're not asking people to go out and organize on your own. What we're trying to do is really respond to community-led and community-identified initiatives and figure out how we can bring our skills to the table with those things. The needs are changing minute by minute, hour by hour. So instead of being able to send out listserv announcements all the time, we're going to be sending those to Kelly for that daily email that you'll see every single day. But we're going to be posting things on our SOURCE Facebook page. So if you're on Facebook or just want to follow that, we're facebook.com/JHUSource. People have already heard about a couple of things. I'll mention a few examples that we have. The Mayor's Office of Neighborhoods, I think many of you have already seen, there's a Google Doc that we've been utilizing citywide for organizations to put in their needs there, but you can also see where the calls for volunteers, and it's being updated as volunteers are no longer needed at certain places. Some of the opportunities that I'll mention quickly, there are going to be a number of drives going on. Right now there's going to be a drive today between 2 and 4 nearby the Duke Burns Arena. They are looking for all kinds of like granola bars, Gatorade, water, non-cooked foods to basically give out to first responders, so you can drop off things there. Casa de Maryland will be having a Peace and Solidarity Vigil tonight. At 6 o'clock at their location. All of this is on our Facebook page, all the details. There will be a cleanup in Pigtown this weekend, which is in South Baltimore, starting at 9 o'clock. They're looking for a little over 100 volunteers. There's actually a form where you can go and sign up. We don't want to send people out there when there aren't things to do, so that's why I want to keep you updated as to how you can become involved. SOURCE has already had a drive in place that was scheduled to go through this Friday, which was a toiletry drive. We've actually just added canned foods to that drive because a number of our community partners have said that their food pantries have been depleted and some of the locations, the food markets have been vandalized in terms of where they go buy food. So we will be continuing to collect canned foods. That's in partnership with a couple student groups, including AHIMSA and the Anna Bacher Society. We do have drop-off locations in the student lounge on the first floor, in student affairs, as well as at SOURCE, which we're down the street between Burger King and the Taste of China, 2017 East Monument Street. Movable Feast, which is another partner right here in East Baltimore. They need volunteers today and tomorrow, packaging meals and putting meals together. You do need to sign up for that, and all those details are online. Please continue to follow us and support us. As we mentioned, there's a lot of people that are interested in volunteering now, which we certainly are going to need your help, but we're going to need your help in the months and weeks and years to come. So please continue to stay involved with us and our community partners throughout the city. Thanks so much.
Thank you. just want to give a quick update that despite the fact that this was lower down in the initial emails that we were going to be having this event, it seems that not only we filled this room, we filled Finestone Hall. There are people who are wondering. I think that the video of this will be made available, so if you're bumping into people afterwards, you can apologize on my behalf, but I think it also, you can say that it will be available if people are interested in seeing it directly. I want to pause for a minute and ask Francis Callahan and Mary Vincitor to speak for a brief moment. Maybe you both could come up, just about what resources are here through the school for faculty, staff, and students who may be directly experiencing stress or other problems as a result of what's going on. I think it's very important that we take care of ourselves and each other, and there are resources for that. And this may be for you, but it may also be for a friend of yours who's really having trouble. And so it's really important for people to be aware of resources that are available. So maybe just a brief discussion would be great. Francis Callahan is an employee assistance leader and social worker through the FASAP program.
Thanks so much for inviting us to participate. So I'm a FASAP clinician, like all the clinicians at FASAP. I'm a mental health professional, and my mission is to support the faculty, staff, and the students of Johns Hopkins. And my colleague Mary is also a clinician for FASAP, but she has a special role as the program manager for JSAP, the Johns Hopkins Student Assistance Program. And our programs are free, confidential benefits to all of you, anybody who's on the faculty, staff, and student here at Hopkins. So wanted to just talk for a moment about the kinds of stress that you might be experiencing or you might experience over the next few days. We're very aware of the collaborative relationship that the School of Public Health has with the Baltimore community, and many of you have been involved in the past and will continue to be involved going forward. And you're going to be witnessing distressing experiences, and you've probably had some, you may well have had some already. So how to kind of support yourself so that you, the change makers, can continue to go forward and sustain your efforts. Of course, self-care is incredibly important, attending to the basics of sleeping, eating, exercising, perhaps considering where your limits are in terms of exposure to images in the media, deciding when to turn it off and give yourself a little break is important. And then, of course, we are here for you as well. We can support you in various ways, including some individual counseling. So perhaps, Mary, you want to talk about that?
Thank you. And as Francis said, I do manage the Johns Hopkins Student Assistance Program. So we have a really close relationships with the student community here, and we have been reaching out individually to the schools to ensure that they know that we're available. And we're really, again, grateful that you've invited us here today. So I think it's a good opportunity to be sure everyone knows what we do offer. As Francis said, we are providing services to everyone, really pretty much within the institution. And the primary resources that we offer are assessment and some individual supportive counseling, as well as referral to resources locally and internally. We also do a lot of work one-on-one with teams and departments. We do group outreach. We'll do events coming out just providing our information and even some handouts, and also do some group debriefing. So I think it's important that you know that if you find that is helpful to you or another entity that you are affiliated with within the institution, that we'd be more than happy to come out. We do provide a lot of information on our websites, both the Johns Hopkins Work Life website and also the jsap.org website. So there's a lot of information about what happens when there's a community crisis or an individual crisis. If you are concerned about a colleague or a cohort member, there's a lot of information for you specifically designed to help you out. We did bring some handouts for you today, and that will be provided probably at the end of the table here as you exit. But we didn't obviously bring enough to share with everyone, and just want you to be sure you know that they are available on each of those websites. Finally, I will be following up and joining with you, the students, in the lounge after this for the event that you've scheduled, whether to have a discussion or if you have specific questions for me, please feel free to ask about JSAP or services and how you can access them. Finally, it's important to know that we are a 24/7 program, so if something comes up and you need to speak with us at any time of the day or night, we will be available for you.
Great, and both for source and for those resources, Kelly and I will make sure that that goes in the email, so everybody will have those links in their email and opportunities to be supportive. So we have 35 minutes to go here, and that's we're going to change the format, and this is going to be we're going to use the discussions we've had so far and the information as a base, and we want to have an opportunity for people to be able to share brief reflections about their own experiences or ideas. You know, we're going to leave it pretty open. What I would ask is that we be respectful, because we want to have a number of people contributing. So this, and to keep in mind that this is really just the start. There are going to be many different opportunities to be engaged, and we will have flexibility to involve other types of initiatives besides the ones that you heard about that we were able to, you know, get going very quickly. So with that, what I will do is I think the plan is that there are microphones on both sides, so people can come over if you want to share anything. I want to also, you know, I should also thank some of the faculty and chairs who were involved yesterday and help us put this together. I see Janice Bowie here and others. Susan Sherman was with us. And so this is just the beginning. And as we think, we should think about both what this means for us and how we can turn our frustration and, many cases, anger and sadness into a very positive force through our engagement with the school. So while we're waiting for people to come up, I'll just say personally, you know, people experience these things in different ways. I have been obviously very involved in Baltimore over the last 15 years, and it has been a very, very sad experience for me to see this. There are other emotions underneath, but sadness is really the one that is, for me personally, hitting me. I was involved as the health commissioner at the time to get a health clinic inside Mandawan Mall. And as part of that, I met with the mall's developers. I met with the health center multiple times. I negotiated that. And there was really a citywide effort to really get Mandawan Mall to be a great place for people to go shopping and to have jobs and to have good food access. And so to see Mandawan Mall be the focus of this was very, very sad for me. That was one of my main reactions. I think of Baltimore as a much more resilient city than people give it credit for. And in the middle of my sadness, I feel like we are not in necessarily the same place that we were in decades ago, that a lot of good work is being done around Baltimore, and that this is an opportunity for schools, people, and the city to pick itself up and move forward. So I do think that it is not preordained how things go. I think Debra Furr-Holden made a very important point that we are going to be coping with some reinforcement of stereotypes through some of the media coverage. But I think that those are things that we're going to have to strategically work to overcome. So with that, I think maybe we'll get going with some comments. And let me just say, if people are watching in Finestone and you're so inspired, you should feel free to come over, all the way over to Summer Hall here and venture down the steps. And we will be, I'll be moving things along. I may also be turning to people who are up here for comments and responses as we move forward. So why don't we start on this side? And if just maybe introduce yourself first.
I wanted to thank you all so much for putting this together so quickly. One of the things that I heard repeated as the speakers were talking just this past few minutes was that the word history. And Dr. Furr-Holden referenced A Tale of Two Cities. I know that this is a school of the social sciences, and oftentimes history finds its way into presentations and into classes. But in an institution where we are very well suited to train people with methods, I think it's incredibly important that we also dedicate the same institutional resources to developing critical thinking skills and helping our students, our staff, and our faculty have a sense of cultural identity. And that's very hard in our environment, given how spread out and dislocated a lot of times we all are from each other. So I just wanted to put in a plug for the possibility of really thinking about the fact that our education and our curriculum, which oftentimes don't get the same types of resources as the other things that we have to tend to, really is a great opportunity and a place for us to demonstrate to our students and to our community that understanding the long history of Hopkins' relationship to the city and the forces that have shaped our work as well is I think, a really important part of how we move forward.
Great, thank you. Maybe I'll ask Dr. Holgrave, who hasn't commented yet, to maybe talk about the role of curriculum as we're thinking about these issues.
Sure. No, I think it's a great point, Amelia. And I think that one aspect of the May 8th event was thinking about sort of what can we do in the very short term, what in the medium term, and what in the longer term. And I think part of the planning for that might be thinking about longer term responses in all the curriculum committee and all of the departments. What are courses we could add? What are elements that we could add to our current courses? So I think that's a great long-term solution we should come back to. Yeah.
Great, thank you. Over here.
Yeah, hi, my name is Beth. I'm a graduate of the Epi Department, a PhD. I'm a postdoc now. We are talking a lot about how we as students and how we as a community can really address some of these issues. But there's also a lot of tension just with the notion of our institution in East Baltimore and how maybe our relationship with taking up land and or displacing individuals. And I was just wondering, I feel that we can do a lot of research. Everyone in this room is a researcher of some capacity, but how is the institution responding and how is that going to play out, if anyone has any comments on that?
Anybody?
I was waiting for Bob Blum to jump in on that one.
Yeah.
Bob Blum question.
So I am not empowered nor even sufficiently knowledgeable to speak on behalf of the entire institution. However, there is no question that there is a broad-based concern. First of all, President Daniels came here with an overt and explicit agenda to connect Hopkins with Baltimore. And it's been an area where he has invested both of himself and Hopkins resources. I would anticipate that not only will that not be diminished, but that commitment will be scaled up. How that plays out is yet to be seen, because these kinds of conversations I know are occurring in nursing, are occurring in the School of Education, are occurring up at Homewood, down at the Carey Business School as well. So there's a lot of discussion going on now. And I would anticipate that when the deans meet with the president and provost, these conversations will come into play there as the institution thinks of how it will move forward. The important point is this isn't moving forward for the next day or two. This is moving forward, how we are going to do our business. And that's the longer haul and more important agenda.
And I think this, the School of Public Health has a tremendous potential for leadership in how Hopkins as an overall institution responds. Go ahead.
All right, I might have to take this off, it's a little short for me. My name is Gia Mejia Naranjo. Hello, everyone. I'm a first-year doctoral student. I also currently live in the 21218 right next to 212 and 7, where most of the rioting took place. But here I am representing a student group that has been researching police youth programming in Baltimore City. And we just wanted to give a very brief overview of a couple of the key findings that we have and some of the recommendations that have been generated from this work, and this will be ongoing. So we'll just quick brief overview. So we've been looking at the history of police youth programming in Baltimore City and how many of these programs have dissolved or lost funding, and how we could maybe make these more sustainable in the future, like you've been talking about, staying connected. So we've conducted numerous interviews and focus groups with 4 key groups: police, community leaders, also youth, and city officials, including several city council members. And some of the top 3 findings that we'd like to highlight today are that these groups, shockingly, or maybe not so shockingly, have common goals. There's a widespread desire by all of these stakeholders to increase opportunities for positive interactions between police and the community. And all are concerned about recreational centers closing, reductions in youth and police program funding, and youth police community positive relationships, as well as reduced community police presence in the community, where people are getting out of their cars and actually interacting with the communities. There are mutually reinforcing cycles of trauma, and I think this is really interesting. Not only are communities often facing trauma, but we have police officers asking things like, how do I police with compassion, and I quote, if all I know how to do is survive and go from call to call to call and deal with trauma? How do I learn to be respectful and stay respectful? How do I do anything in the most professional way if nobody around me is doing it and nobody's teaching me how to do it? So there are definite opportunities. And lastly, that as we probably all suspect, sustained programming, funding, and political support are needed. So some of the key things we think we can do going forward, and I'll be very brief here and hopefully continue the dialogue going forward, are and some key recommendations that we think Hopkins is in an ideal position to help convene these 4 and maybe other stakeholder groups in doing things such as developing and maintaining long-standing quality police youth programs. For example, we went to Baltimore County. One of the big issues is funding keeps dropping out and programs are dying. Well, Baltimore County created a nonprofit organization that funds police youth and police community programming, so it's sustained regardless of political leadership changes and regardless of city or county budgets. Something to think about. Integrating quality community relations training at all levels of police. And we have connections with the police department, and this is something I think we can really work on. Not just there's a community partnership division. It's a great group of people, but it's about 20 officers. But integrating this type of community-based mentality across the police department. Working to revise incentives for police officers so that they're not just counting the number of arrests, but the number of positive contacts that are happening in the community, perhaps linking youth, homeless youth, to social services, things like this. And lastly, implementing very multi-level approaches that are looking at some of the structural factors. And we do have expertise that I think we can and should tap into, looking at issues of illicit activities, job opportunities, and improving community police relations. So with that, I'll conclude, and this is a study going on under the leadership of Dr. Peter Winch, if people have more questions, and I thank you for having the floor.
Could you send me the photo?
Thank you very much.
That you took?
Anybody here want to respond to that? Tom, is that something you might want to see on the website? Sorry about that.
Yes.
Okay. Excellent.
Yes.
Excellent.
See him on the website.
Yeah, we should.
After,
Exactly. Excellent. Sorry about that. Go ahead.
Hi. Hi. My name is Rachel Bergstein. I'm a first-year master's student in the Department of Health, Behavior, and Society. And I think at a time like this, one of the most important things that we can do is to ask uncomfortable questions. And Dr. Furr-Holden, you suggested that we should measure our success by how the needle moves on the metrics of social determinants of health. And I think that there are many people and many institutions at this school for whom that is the case. I think there's many others for whom the metric of success is how many grants come in from NIH or how many articles are published in a research journal. I think this institution has a long history of it as an institution of science, and I think science is based on the idea of objectivity. I personally don't think that objectivity exists, particularly in a field like public health. I think it is incumbent upon us to be political advocates, to mobilize, to take risks. And I personally don't think that that is the ethos of this institution. And so I think at a time like this, it's very important for us to be asking ourselves, what is our definition of public health? What is the kind of public health we are trying to do at this school? What is the kind of public health that we are doing at this school? And I would argue that maybe not on purpose, but there's a process of sanitization that happens here by which, we are encouraged to make a valid regression model more than to mobilize politically around issues that are important. And so I just think it's really important at this time to be asking ourselves, is that what we want to be doing here? And if it's not, how we can change the ethos of this institution to mobilize and make lasting political change on the structural and social issues that we think form the bedrock of public health in this country.
Okay. Thank you, Rachel. Dr. Blum, do you? Okay, good.
So I agree with you totally and completely. And I've been here for a very long time. You might not know this, but I'm 40 years old. I came here in 1992 as an undergraduate from Sea Pleasant, Maryland, which is right outside of Northeast DC. I went through Hopkins undergraduate. I went right into a doctoral program in the Department of Mental Faculty Ed. I went straight to a postdoc. I probably worked with 7 or 8 different faculty as a primary mentor over the years, and probably another 20 as secondary mentors. So I've been here in different capacities, starting first as an undergraduate research assistant here in the 90s, and then moving on to faculty. And what I can tell you is I've seen somewhat of an evolution. When I was a student in mental health, the only degree we offered was the SCD, very science-based. We took classes in psychiatry. Now we offer a DRPH program, we do public health practice. Some of the things that you're talking about around people mobilizing, there are people in this room that I was going to present something to a community group on Capitol Hill, to NIH, and I presented in all of these various forms. I would absolutely want them in the background, making sure I had the best stats, that I wasn't juking the numbers, that I was bringing very good science to bear, but by no means did I want them standing next to me advocating on Capitol Hill and mobilizing change. That's just not what they do. That's not in their wheelhouse. So I just want to caution folks, because one of the things that I love about how the university has changed, I teach a drug policy course, and I ask you, well, how many folks are PhD students, and 1 or 2 raise their hand? How many are MHS students, and only 1 or 2 raise their hand? I said, well, what are the rest of you? Oh, I'm MPP, I'm an MHSPH. I was like, we offer all of those different degree programs. It's really interesting because I feel like we have gone from being a research-intensive institution to now we're striking this really amazing balance between research, both quantitative and qualitative, and everything in between. We've got public policy people, advocates, researchers across a wide range of expertise. So I just want to encourage people, all of what we do is, I think, important, right? But everything isn't for everyone. But for those of us who are the sort of researcher advocates, or for those who are sort of in the background driving the engine and doing that important work that gives us what we need out in the world, the credibility to speak with authority, right? I think we could continue to work and unpack how to do that better. But I've seen major progress in the 20 plus years that I've been here.
Right. Thank you.
Thank you.
I want to make sure we've got using as much time as we can for people. So maybe is there someone on this side? Sure.
Hi, my name's Luke Kaub. I'm a second-year PhD student. I have one question to the audience and then one question to the group. So it's an interesting segue. We're talking about actually providing local resources. So my question to the audience, actually, if a show of hands, how many students are actually from Baltimore in this room? Okay. And so I'm from Baltimore. I'm a native. And of the maybe 4 of us, one is an African-American male, and we're both from the Department of Mental Health. So I think that's important that we recognize that we also have a commitment to educating people that are from here, from Baltimore. And I found that it's actually a rarity to see somebody from Baltimore that comes to the best school of public health, in my opinion, in the world. So that's just one thought. So my question to the group is, as I've been here at Native Baltimore, I've seen the expansion of Hopkins as they've changed East Baltimore, and there's been a raising where they've removed residents and they've brought down homes, and they're building and restoring this area. So my question is, one is, what has happened to the residents? What has the relationship been like over this course of time? And what is the future of that project? Because I read an article this morning in the New York Times about the riots in Baltimore, and a young man said, there's dilapidated houses all over Baltimore, and I live in a war zone, and I wonder just how that project is going, because that's been an important interface with our community.
That's great. It's a good question. Bob, I'll give you a quick response.
Yeah.
Because a lot of these things can be delved into more next week. I just want to make sure we have plenty of time.
Quick response. As Debra said, the population in 1960 was 1 million. The population is 629 now. So there's a lot of empty housing stock. There's also been a lot of renovation of housing stock. You asked about relocation. And I'm not going to be an apologist for the EBDI program, because eminent domain was used in phase 1. It probably was not the best strategy. One could argue that. When you look at the outcomes for people who were relocated under eminent domain, 92%, that's 92% have said that they would not choose to return. They like where they are. They have had 5 years of support, and many of them longer than 5 years of support, and a lot of financial support that was underwritten by the Annie Casey Foundation primarily. So the process left a lot to be desired. The product, many would argue, it has benefited the residents in the neighborhood. It has brought the first school in East Baltimore, the first school that a new school that Baltimore has had in over 35 years, and a resuscitation of a neighborhood, and positive spillover.
Great.
Obviously, a lot more could be said.
Great, thank you. Yeah, sure.
I would also say multiple students have brought up the institution's history, rightfully so, and I would just like to say that through my work in Source and my work in the community, so often I feel like as students we're in a position to be healers of that relationship with the institution and make that direct contact ourselves and repair those relationships that have existed. And so I think that what's going on in our city provides another really wonderful opportunity for us to go out there and do that work and become the face of the institution, kind of regardless of those historical.
Thank you.
Everyone seems to be holding. Hi, my name is Nicole Lenardi. I'm an alumni of the Population, Family, and Reproductive Health Department. And I wanted to just touch upon something very briefly, something that Dr. Furr-Holden brought up and then very beautifully Mindy Levin finished upon, which is really about like this huge question of how do we build off of the needs and the desires of the community. And I know that's been a theme even in the comments and questions here. I come to this place right now through wearing multiple hats. I have worked for the Baltimore City Health Department. I have many friends and loved ones in the Mendowment and East Baltimore communities that I spent the majority of my day with just standing on Baltimore street corners. So while I don't encourage that we all, load buses and head up to Penn and North, I did spend some time up there yesterday, and I think just my comment is I want not only for this to be on the onus of Source, but to be on the onus of all of the initiatives that are coming out of this, to really think critically about how we are identifying the needs and the desires of Baltimore City communities. How are we assuming what they are because we have the research studies? Are we doing focus groups? Are we getting out there and are we doing, having conversations, having community forums just like this with the community, alongside the community? Because a lot of what we research and we've studied through our grants and our studies, they know through lived experience, and it's just common sense. So I think that we just need to be very conscious of that relationship moving forward. I'm not saying that it doesn't exist, but there are a lot of grassroots organizations. There are a lot of mom and pop, you know, whether they can accept volunteers, whether they advocate, whatever they do in these communities that exist, they're already there. They don't need to be built. They just need to be supported. So how do we put that call out to the community and humble ourselves? You know, we've heard so many times today, we are the experts. We are very intelligent, talented, beautiful people in this room who care and have compassion and empathy. But how do we humble ourselves and just say, you know what, we're here. What do you need? And I think SOURCE does a great job at that, but I just want to encourage all of the initiatives and all of the kind of momentum and the wind that's blowing behind our sails right now through this horrific event that has garnered the attention abroad, nationwide, citywide, et cetera, that we are humbling ourselves and we're really listening and not just saying, this is what we're going to do, but saying, how can we help you and how can we support that?
Thank you. Thank you. I think that was extremely well said. I think Dean Klag in his email said that the principle for the school's engagement should be humanity and humility. And with that in mind, we have been getting questions, I think, on index cards in the other room. I'm just going to read a few so people are aware. One is, will we be setting up a program to encourage faculty and staff to volunteer their time to help rebuild, similar to partnership for volunteering we have with the city schools? I think that's an interesting idea and follows up on that question pretty well. Another one is, how do you intend on including Hopkins staff, such as security guards and cleaning staff, in the process? And that's a very good question. One of the things that, or one of the work streams we're going to have is with the staff. And I'm working with the HR department right now to identify a number of staff that we can be in touch with for both directions, ideas that they have, making sure that they're included in other activities that are going on in the school. That's very important to me. And then there was another one, which is, can you comment on the challenge facing the mayor and the city's efforts? And I certainly would briefly say that it is very, very difficult job that the mayor and the city have right now. I have tremendous respect for the mayor. This has been a extremely difficult set of situations, and you know, it is almost everything that you do can be criticized. And so, I think under the incredible pressure, she has done a very good job, and I think that she's the right person to see Baltimore through this right now, and I think everybody will see that. Over here.
Hello, everyone. My name is Nicole Parker. I'm a fourth-year PhD student in the biochemistry department. I'm not going to lie, Nicole kind of took my thunder a little bit with her question, but I will add on to it. I went to a meeting last night, and I really do feel it's important for us to support the organizations that are already in the community. And for instance, it might be something people don't want to hear, but these people in West Baltimore are African American, and they take advice better from an African American than anyone else. And I think it's important to reach out to those organizations that are in that community that already know the kids, that know exactly what's going on, and they are the ones that need the help from us. We don't need to go in with anyone in particular. We just need to help them grow what they already have. In addition, I just had a comment. I really appreciated the introduction by Dr. Furr-Holden. I feel like here that there has been a little bit of racial insensitivity due to the fact that there was a lack of knowledge of what had really been going on. I've heard people say, why are they rioting over just this one thing? It's never about just this one thing. And it's been really hard for me to deal with it the past couple of days because it's hard for me to talk about it with people who aren't of color because I feel like they don't understand. So I really appreciate your introduction, and that's just my comment.
Thank you.
Hi, my name is Madeline Beebe, and I'm finishing up the MPH program. I'm also a nurse and have been here for the last 5 years. I went to nursing school here, and I've worked in the ER across the street for the last few years. And I think that although there are amazing things happening here, and Dr. Bloom touched on some of the different things that we've been doing, it's still far too easy to come to this institution and be at this institution and be completely blind to the types of issues that have led to the frustrations that we've seen emerging over the last weeks and months and days. And I think that there have been some really great suggestions, and I'm really happy to hear about some of the specific things that we're doing in response to the last week or so. But we talk a lot in this building about systems change. And I think that there are a lot of things that could happen within this building with regard to how students enter into the programs that they come into and the information that they get as they come in and what's asked of them during their time here. And it's okay that some people come for 11 months and leave. It's okay that some people come and focus on disaster preparedness in other countries. Different people do have different wheelhouses of expertise. And not everybody needs to come and have West Baltimore and poverty in Baltimore be their passion issue. But I do think that part of what happens as a part of receiving this education, which is an incredible privilege, we all should be required to learn and think and be uncomfortable and get more information about both the city, but also the role of our institution in the city. And so that's my first thought. Like, I think that we could add required components into orientation and curriculum, and I think required is a key word. And then the second question that I have is about community participation in this process moving forward. Dr. Bloom, you did a great job of trying to respond to this question about the community around us and the changes that have happened in a very concise fashion. But I also know people who were displaced from the Middle East community who would offer very different characterizations of that process and how it affected their lives. And I think that those voices should be in this building, and they should be part of what we're hearing as we come into this building and come into Baltimore. And I'd like to know how community organizations and community voices are going to be part of the dialogue that we're having with ourselves, because Hopkins talking to Hopkins, I think, is part of the problem, and it needs to be a bigger conversation.
Thank you very much. I don't think you'll find disagreement with that statement, and I think what we're doing is we are setting up for a sustained engagement.
So I'm not going to disagree with that statement. I just want to put a bit of a caution out. I think we all have a natural tendency. We're very smart people. Everybody here has their own sort of worldview and sense of what's reasonable, but it doesn't always jive with what's actually happening out there. So there's this myth that Hopkins has this horrific relationship with the community. I will tell you, it's far more complex than that. There are many of you who have been in courses that I teach that have a practical component who have gone out and marred my good name. I have vouched for you and sent you to places, and you have been very entitled and privileged, willing to do certain things, and then some of you are on the Save the World campaign, and then you go too far, and the term ends, and then you can't follow up, and they still need you. So it is just far more complex than that. But what I will tell you, hands down, is Hopkins has some pretty significant partnerships with several, everything from the mom and pop shops to some of the other major FQHCs and other community-based organizations, youth serving organizations, etc. Many can speak to that. If you choose to be in the cadre of folks that are ambassador for the university, I just encourage you to take that with you. You aren't necessarily overcoming anything as much as you are helping to strengthen some of the relationships that already exist and creating new conversations. If you walk into a place with this, sort of notion that we have some bad rapport with the community, you stand there and you're either overcompensating for something or you're underperforming. So I just want to say there's a lot more complexity to this than what you know, and there's also a lot of goodwill between Hopkins and several community members and organizations.
And a couple more
you.
very quick points, if I could. One is that for the last 5 years, the Urban Health Institute has held in the basement of Amazing Grace Lutheran Church 4 to 5 times a year ongoing Hopkins community dialogues around race, racism, power, and relationships. Everyone is welcome. The second is that we hold numerous community forums. We have one planned in 2 weeks. We tend to use Humanum up on Gay Street. because it's a large community-based venue and it's open. It's how we planned the trauma symposium. It's how we do all our work. And this is just one snippet. So there are substantial conversations. That isn't to say, Madeline, that you're wrong, that we couldn't do a lot more, but it is to say that there are substantial ongoing communication and dialogue with many of our neighbors.
Tom.
So I mentioned earlier that I've been here 25 years, and when I first moved to this city, I was, we were trying to decide where we were going to live, what community, and trying to learn the city. And one day I was driving home from work, from my office here on campus, and came to a red light, a stop sign, a stoplight, where I saw a liquor store, a bunch of men standing outside selling drugs, drug transaction occurred right in front of me, and to my right was a massive public housing project called Lafayette Court. Now, Lafayette Court reminded me of the public housing projects where I grew up in Brooklyn, New York. It just seemed so familiar to me. So I decided to turn and go into Lafayette Court and go into the community center, where I walked in and started talking to the people there in the community center about what they were doing and what were the activities for youth. I started working with them as a volunteer. We put together a basketball tournament where we brought kids from Baltimore County into the city and played them and brought them out to the county. Did a health fair, of which the School of Medicine and Nursing and the hospital was very generous in coming over and providing services for that health fair that we did. And then the community was imploded, right? The people were dispersed mostly throughout other parts of the city, and the relationships that we were building dissipated because the organizational structure that was in place dissipated. Shortly after that, I decided to take a leave of absence from the university and did something, and I'll warn all junior faculty here, it was a reckless thing to do, and you might not want to do this as an assistant professor, but I took a sabbatical and went over to the West Side and worked at what was at the time Liberty Medical Center. Liberty was one of the few remaining black hospitals. We used to have a whole national network of black hospitals throughout this country, and Liberty, formerly Provident Hospital, was one of them, and worked there. That hospital was then merged or taken over by Bon Secours, depending upon your perspective on what exactly happened. But the relationships that I developed over in West Baltimore has continued. Now, I said that to give voice to the criticism that we've heard from Rachel and the other student who I don't know, because I do think there is some validity to some of what they say, while I also agree with my colleagues on the panel that there's a lot more that we as an institution is doing in Baltimore City than most of us realize. And a lot of it is because we operate in silos and we don't all necessarily know what each other is doing. But also, the academy, academia, is set up in such a way that it does not incentivize people to do that work and to go out there. There is no incentive to go to Lafayette Court housing projects and go into the community center and work with the people there and help to bring resources for them to do the work that they were doing. We also work with Flag House, by the way, if anyone who's from Baltimore will know Flag House projects. There was no incentive. In fact, it was crazy and reckless from a professional standpoint to take a sabbatical as an assistant professor and go work at a hospital and help them to do a number of things within their hospital system, which didn't lead to a single publication, right? Which, we did ultimately get grants. There was a grant. There was a grant. Much. What am I, crazy? No, much of the. No, well, much of that grant was in conjunction with community-based organizations, and a lot of those resources went to those organizations. So what I'm saying is that it is true that there's no incentive to do that per se, because there's no place on the CV for working with Flag House and Lafayette Court housing projects. Yeah, the good deeds section. Right. On the other hand, having just rotated off of the Appointments and Promotions Committee, so if you are in that trajectory, I'm no longer on that committee, so don't come to me to complain about it. What I saw in my time on that committee is that the committee does go out of its way to incorporate public health practice into evaluation of faculty performance and promotion, and that increasingly people are able to get promoted here for the public health practice work that they do. When I came to Hopkins, we did not have an associate dean for public health practice, and we are now on our second associate dean for public health practice. So there's a lot of complexity to this issue, and I think that there is some validity to some of the criticisms that we've heard today, because the academy is set up in a way to do what the academy does, which is create new knowledge and try to disseminate that knowledge into the world. That is what we do. That's the core function of the institution. But on the other hand, in spite of the fact that there are not many incentives to do that, you know, that story that I told about working at Liberty Medical Center and Flag House and Lafayette Court projects is a story that many faculty members here could tell of their engagements in what Dr. Furr-Holden referred to as the other Baltimore.
Great. Thank you. Thank you for that. We're wrapping up. I want to maybe ask for one more comment. The others who've been so patient and waited in line, I'm begging you to come down and see me afterwards so I can talk to you about what you wanted to say. If you are willing, I will be here. But go ahead.
Hi, my name is Jifa. I'm a second-year PhD student in HBS. And many of you talked about the negative media attention that's come out of the unrest in Baltimore. And I think that we as an institution could also do more to engage with the media and try to reshift the focus to the larger issues and to the social determinants. Because I think I think it's a good idea that this town hall that was organized, but I feel like when we only react to the community response, or when we seem to express more outrage or sadness towards what the unrest is going on in the community, then we only reaffirm the notion that the lives and living conditions of the people are less important than the damage that's being done. So I think we need to also strive to do more with the media to focus and express just as much outrage at the violence inflicted by the police and the living conditions of the people of Baltimore.
Thank you. And to that point, let me just mention that the school's been contacted by a lot of journalists asking for insight on those issues. I think it's really important that some of the people you've heard today and others who are doing research are able to really speak to that. And I'll also point out that a lot of news stories have quoted the 20-year gap in life expectancy and some of the problems. I don't know if everybody knows this. Those studies were done here in collaboration with the health department, in part because Dean Klag provided half of an epidemiologist to coordinate a lot of work for the first time in understanding neighborhood health. And so some of the critical insight that people have, some of the only articles that are talking about the root causes of this are quoting work that was done here for the purpose of making that information available. So let me thank everybody who has spoken. Thank very much the people who have asked questions. The people who are still in line, I want to talk to you afterwards. And finally, the point I would make is that this is the very beginning of a sustained engagement on a very important issue for the school and our city. And I'd like to see whether Dean Klag, if there's something that you want to offer by way of closing comments.
I would just say, well, you know, when we talked about this is what I hoped it would be, and it was great. So thank you, and thank everybody.